Dr. Duplechain, society seems very breast obsessed. What's your opinion on that?
Well, you know, I think that women like to look great. They like to look great in their clothes. Their husbands like to have them look great. So, I mean, and that's been a concept that's been around for a really long time. So I'm not sure that there's a lot new here.
Well, it's not always for aesthetics, though. What are some other reasons people might consider breast augmentation?
Well, you know, I had a patient a couple of months ago that was a lady who had had a couple of kids, and she was in her late 30s, who had what's called tuberous breast syndrome, so that the breast was very flat, they were very asymmetric. And she told me honestly that she never felt pretty.
Coming from a full C, dropping down to between an A and a B, it was really depressing. It was a drastic change that I couldn't adjust to. So prior to me having the surgery, I had stretch marks, and it brought my self-confidence down. Just the way I looked in bathing suits or just regular clothing, I didn't feel like myself.
And she lived her whole life like that. So she came in and we did a two-stage reconstruction where we basically lifted the breast and kind of changed the shape. And then we came back and did implants. And she's got to be one of my happiest patients. She tells me when she comes in, she's my #1 fan because she just feels pretty and she feels normal and natural. And those kind of things really make you feel good about what you do.
It definitely boosted my self-confidence. I fit better in my clothing, and overall, I feel better about myself.
Years ago, there was this tendency for people to go, oh, she must have had her boobs done, things like that.
Yeah.
But it's so commonplace now. What's the difference?
You know, I think it's been around now long enough. You know, breast aug started, I guess, in the late 60s, early 70s. And so, you know, it's gotten to be something that's pretty readily accessible. I mean, a lot of people are coming in for lots of different reasons. You know, young women maybe who didn't develop completely or who maybe just feel like their clothes don't fit the way they want. You know, maybe a mom who's had a couple of children whose breasts have become a little bit saggy and doesn't feel as attractive as she used to, maybe in clothes or in swimwear. So there are lots of different reasons that people come in and do it.
Is there any size limit to breast augmentation that you will do? I know there are some women that want to have the Guinness Book of World Records type breasts. What are your limits?
Well, you know, my rule is it's not too big. So we come in and we try to kind of let the patient decide. But, you know, there are lots of problems if you go too big. I mean, what happens is because there's some weight to those implants, you know, the breasts get to be droopy and heavy and they can even extrude. So there's some pretty good rules that we use to try and help people guide. At the end, we let them decide, but I haven't had to turn anybody away yet, so.
And as far as size, we were just talking about that. What's the best advice you can give a woman that's considering breast augmentation as far as finding a good visual picture or really having an idea of what size and kind of expressing that to you so you understand?
Well, what we do is I mean, it's a pretty simple process. We have them come in. We have lots of different size implants. So we have them come in. We let them try the implants inside their undergarments. We let them stand in the mirror, and they may spend an hour or so doing that, basically kind of experimenting and kind of looking at the look. And then we take some measurements to make sure that we think that that it's the right size for the patient. But we let them spend enough time and look at their shape and make sure that they think that their clothes are going to fit the way that they want. And in reality, that's kind of how we let them choose.
I did a lot of research, online research, and it was between two of the doctors in Lafayette, and he just looked like he can relate to my issue, and he would welcome me with open arms.
Is there a silicone or saline preference these days?
There is. I mean, silicone, you know, since it's kind of gotten back on track with the FDA, I mean, we're doing about 90% silicone. I mean, you know, saline's been around for a long time. It's a great product, but the silicone seems to have the edge right now.
And it has the edge because why?
Well,
Go ahead
it feels
and say
more natural.
it just feels better. I know that's what.
It's a more natural feel. It really is.
Sure. So there's so many things that are tied into not just the physical appearance. There's a lot of self-esteem issues tied in with women's breasts too. Tell me a little bit about that.
Yeah, I mean, you see that in younger patients, and really I think in a lot of our patients. You know, what most of these patients are looking for, the average, young girl or lady that comes in that's interested in breast aug, they just want to look great in their clothes. They want to look proportionate. They want their tops to fit their bottoms, so that everything looks, proportionate.
I think it was just evening the proportion out because it was completely flat right here just about, and then I have hips, and it didn't look right. And being a woman,
So a woman's decided to make that plunge, they've had surgery. What's the feel that you get from this woman when she comes back to you after surgery?
The neat thing is that when patients come in for consults, they decide very, very quickly for breast aug. It really doesn't take them very long to make their mind up. So it must be something that they've thought about for a long time. The excitement when they come back after they've had a chance for some of the swelling to go down and see what they're really going to look like. I mean, it's a lot of fun. I mean, they're excited. Their spouse is usually going to come in for their first post-op visit.
Oh, so the spouse is excited too.
Yeah, they are.
No.
And I like it. I like it when the husbands are involved or the spouse is involved to come in and kind of be part of it. And they're very excited. They're anxious to know when they can get back to normal activities. But it's a quick, easy procedure that seems to have a very, very high satisfaction rate.
Does the spouse sometimes get a little too involved early on in determining the size?
Sometimes, they do come in and obviously they have their thoughts about it, but, at the end of the day, the lady gets to make the decision. I mean, that's kind of the rule around the house.
Ladies' preference.
Exactly. That's exactly how it is.
Number one thing you want to look for in a cosmetic plastic surgeon is the ladies make the rules.
Yeah, and that's exactly how it is, yeah.
I do wear low tops now. I like to show off what I have because I'm proud. They look excellent. Dr. Duplechain did a fabulous job, and so I wear a lot of low-cut tops, and they look extremely natural. Like I've never had any type of work done. It fits my body perfectly.
And she's done other than the